Thank you. What a great speaker to follow. So thank you for that inspiration. And thank you for joining us. It's been a long and really inspirational day, so thanks for having us. I am so thrilled to be surrounded this afternoon by really not only the leaders of today, but the leaders of tomorrow. I think we're talking a lot to the young women and young men in this room. So really glad to be here and in the presence of women and men who are committed to changing the world. My name is Jill Lesser. I'm president of Women Against Alzheimer's and a co-founder of the Global Alliance on Women's Brain Health. So we're here today to bring attention to work on solving some of our toughest global challenges by 2020 using guidance, as we've talked about all day, of the United Nations Sustainability Goals. You've heard from leaders in the fields of finance, tech, business about their disruptive ideas on how to reach those goals. What do we need beyond grit and determination to solve these problems? We need our brains. Some of the biggest, most innovative brains out there. So why aren't we talking about our brains, and why aren't we talking about brain health? My panelists and I are hoping that we can start a conversation and start to change that. So I want to see in this room, raise your hand if you've had personal experience with someone struggling with the health of their brains. So almost everyone. I do too. I've been an Alzheimer's caregiver for my mother for 10 years, and I have a son who's 17 who suffers with debilitating anxiety. So I certainly know the issue. I, like many of you here, are trying to manage a career, one that, frankly, I am lucky enough to have access to, a family, aging parents, my own health, and guess what? I live in the U.S., so my problems are nothing compared to the millions and millions of women around the world in low and middle income countries. So our brains are important at every stage of our life. We're learning more and more about brain health in younger people, with anxiety, depression on the rise globally, the devastating impact of traumatic brain injury from sports, from military service, and domestic abuse. But what we're not talking about, particularly in the global context, is brain health in the context of a global health crisis and the impact on our economy. So there are 3 super aging countries today where more than 1 in 5 in the population is 65 and older. By 2020, that number will be 13 and almost triple by 2030. There will be 34 super-aged countries by the year 2030. So think about the sustainability goals. And now imagine what the world will look like. We'll see an increase in the number of age-related conditions, heart disease, diabetes, depression, and of course, Alzheimer's and related dementia. So we are here, I am here really as a poser with these renowned scientists to talk about a focus on our health and why it is we're leaving out sort of the nerve center of our bodies. So let me give you a few statistics. There is virtually no concerted drive to fund research on brain health. And for too long, the issue's been overlooked. So let's begin to think about it now. And in particular, in this conference on women, if the future of healthcare is in precision medicine, then sex-based research is the gateway. And so we're here not only to speak about brain health in the context of aging societies, but we're also here to encourage us to think about how this is an opportunity. We are on the leading edge of precision medicine, and we have an opportunity to make sure sex-based research is part of that from the beginning. Let me just give you a little bit of statistics on dementia because I think it's important to set the conversation. Today, dementia has a global economic impact of $1 trillion US. And as the number of people with dementia increases, almost 60% over the next 12 years, reaching an estimated 74.7 million globally by 2030. Most of this burden falls on low and middle income countries where 58% of people with dementia live. So imagine that toll, not just from the perspective of the patient, but the fact that most of the care for dementia is unpaid, uncovered by traditional health insurance, whether government health insurance or private health insurance. includes mostly the activities of daily living. So these are out-of-pocket expenses that are borne by families of women who are trying to, as they try to get clean water for their kids, are having to now think about aging parents. So let's talk a little bit about women. Women are 2/3 of the victims of dementia globally. Women in their 60s are twice as likely to develop dementia as they are breast cancer. And even for women who are not personally affected as patients, we make up between 2/3 and 75% of caregivers. So let's talk about what we can do and the opportunities to change this conversation and add brain health to our conversations about global women's health broadly, and also to our conversations, frankly, about women's economic empowerment and what the barriers are. So today I'm joined by a cross-functional panel of experts who are really disruptors. Their research is cutting edge and really directly in the spirit of Ideagen. So I'm going to let them introduce themselves, but I'm going to start with Dr. Carolyn Mazure, who is the Norma Weinberg Spungen and Joan Liebsen-Bildner Professor in Women's Health Research and Professor of Psychiatry and Psychology and Director of Women's Health Research at Yale.
Thank you so much, Jill. It's a pleasure to be here. I'm going to take a step back from some of what Jill said, which is really vitally important to the panel, and mention that I started an interdisciplinary center at Yale called Women's Health Research at Yale some years ago. And the purpose of that was really to bring scientists together from many fields to conduct research and to train the next generation of scientists. The point that I want to make is that our explicit focus is to study women and to study sex and gender difference in health and disease, and then translate those findings for the benefit of everyone. Why do we do that? Why is the explicit focus on women and on sex and gender differences? Well, we do this to remediate the dramatic gap in knowledge regarding women's health that began and continues today as a function of underrepresentation of women in scientific studies and women's health not being the target of investigation. Our studies reach across a range of critically important areas of investigation, from brain health to life stress, and disorders from cardiovascular disease to cancers. And we do this in a biologically and psychosocially integrated manner. The days of entertaining a dualism between one's mind and one's body are long gone. And we must conduct our science in a manner consistent with the notion that the systems within and external to our body interact. And at the center of these interactions is the brain. So in summary, for my 2-minute introduction, some steps to improve brain health globally. First, study women. Second, study brain health in a biologically and psychosocially integrated way. Third, realize that we must study differences among women and men across the lifespan. There is no single representation of women or of men. And finally, as a clinician and as a researcher, it is my observation and it is my experience that life stress can trigger ill health and worsen adverse health, particularly for women. And as we study brain health, we must incorporate the study of how stress affects us and how to negotiate stress. More to come on that topic in my later comments.
Thank you, Carolyn. I'm going to turn it over to yet another Jill today. I know there have been a lot of Jills here. Dr. Jill Goldstein, who is Professor of Psychiatry and Medicine at Harvard Medical School and Executive Director of the Women, Heart, and Brain Global Initiative. So same question, Jill. How do the UN Sustainability Goals, the ones that we've been talking about all day, good health and well-being, gender equality, decent work and economic growth, reduced inequalities, talk about how your work informs these goals and what steps we need to take to improve brain health.
Well, I see women's health as economic health. Why? Women really drive healthcare utilization in our families, which means in our societies. Women bring the workers in their family to work. They bring them to the physicians. They drive healthcare utilization dollars. And so maintaining women's brain health, I see as critical to the health of our economies. Now, women's brains are not the same as men's brains. They look the same, but the size of some of the parts and the wiring and the speed of processing actually differ, even though essentially the functions are the same. And brain health is not only about what's going on in the brain, it's also how the brain talks to the body. In our case, in our work, how the brain talks to the heart, even directly, electrically, and how the body talks back up to the brain. And men and women do this differently. So in healthcare and in public health policies, the development of therapeutics, the development of healthcare systems, public policies, and programs need to take a cross-disciplinary approach. We usually live in silos in medicine and in healthcare, taking a cross-disciplinary approach, applying a sex difference lens, and we need to do this because the health of our economies depend on it.
Thank you. Next, we have Dr. Richard Isaacson, who is Associate Professor of Neurology at Weill Cornell Medical College and the Director of the Alzheimer's Prevention Clinic. And Richard, I would ask you the same question, and note that your work is focused on prevention. So as we try to keep the world healthy and bring brain health into the conversation, particularly interested in how your work is informing that.
For having me. So I have 4 family members with Alzheimer's disease. I've seen this disease since I was this big, and I diagnosed my dad's cousin Charlotte at a wedding about 10 years ago. So I've seen it before my training and after my training. I think the shocking thing that I just want to reiterate that Jill said is that 2 out of every 3 brains affected with Alzheimer's is a woman's brain. Okay, 75% of the caregivers of a person with Alzheimer's or dementia are women. This is a woman's health issue. And we got the breast cancer. We're making progress with that. We got the ribbons. We need the same thing for brain health. Absolutely has to happen. The other thing that I think people don't realize about Alzheimer's disease and why I've taken a preventative approach is that Alzheimer's disease starts in the brain 20 to 30 years before the first symptom of memory loss. Whoa, let that sink in for a second. 30 years. Okay, when someone has memory trouble, that doesn't mean that they just started dementia right then. It doesn't work that way. Like heart disease, like other diseases, it starts over the lifetime. So we started the Alzheimer's Prevention Clinic several years ago, 5 years ago now, and we follow people between the ages of 25 and 91. Okay, and we follow these people and we try to implement brain healthy choices because early life, midlife, and late life risk factors are different. Also, it took me about 3 or 4 years to even realize that men and women's brains are different. I'm going to be honest with you, I just never looked at the data that way. I looked at people that had bad memory versus normal memory. Never occurred to me to separate how our interventions work for prevention in women versus men. And guess what? Totally different. So to conclude, you mentioned precision medicine. Precision medicine is a term you may or may not have heard about, but instead of a one-size-fits-all approach where we say, oh, Bob, you do this, and Jim, you do that, and Mary, you do that, and you all do the same thing. No. Mrs. Jones, she's going to need interventions A, B, and C, but Mr. Smith is going to need interventions X, Y, and Z. So by following people over the lifespan, thinking out prevention and brain health early on, it's not just about living longer, it's about living better. And in my opinion, there's no better way to live than with a healthy brain. Thanks so much.
Thank you, Richard. We're going to move now to Dr. Suzanne Steinbaum. Dr. Steinbaum is the Director of Women's Cardiovascular Prevention, Health and Wellness at Mount Sinai Hospital here in New York and a Fellow of the American College of Cardiology and the American Heart Association. So I would ask a similar question to you, Dr. Steinbaum, but I think we have to acknowledge that brain health really is where heart health was 25 to 30 years ago. In terms of thinking of, first of all, women as little men, we know we learned the hard way in the area of cardiovascular health, and also in the question about prevention and lifestyle and how we can potentially affect our risk of the disease. So talk to me a little bit about your work and its relation to brain health.
There is a significant connection between the brain and the heart. I think we all intuitively understand that when we think about heartache and heartbreak, and really what it feels like to be under stress and pressure and have our hearts pounding. But not only that, when we think about the health of these organs, we're talking about the health of the arteries more than anything. And the health of the arteries comes down to how we choose to live more than anything. About 80% of the time, heart disease is preventable through lifestyle choices and decisions we make about how we live. It comes down to cholesterol, blood pressure, our sugars, our weight, exercise, our diet, and smoking. And these risk factors are what leads to heart disease 80% of the time. And in fact, 80% of the time, heart disease is preventable. And what we understand are those risk factors are equally as important in brain health. And when we manage these risk factors, and it depends on which risk factor we're talking about, it impacts the health of our brain and our hearts. Part of our global initiative in investigating brain health and understanding it, like we did 15 years ago with heart health, is understanding the importance of these risk factors and the importance of lifestyle intervention and taking control over our own health, which we can do in making an impact on brain health.
Great, thank you very much. So I want to move on to a question for Dr. Mazore and Dr. Goldstein. I want to drill a little bit more deeply into the issue of sex-based research. So first of all, I want to talk a little bit about how sex-based research is really not about research on women. I think as we often see, where we think of if we give women some extra attention, we're really just thinking about women. And it's really important to understand the value of sex-based research for health more broadly. And then secondarily, as we have identified today, so many fundamental challenges in basic healthcare and access to healthcare and understanding healthcare in low and middle income countries. How does a sex-based approach help us get to the answers more quickly? So Carolyn, I'll start with you.
Okay. Thank you. Well, I want to take my first minute of just a couple of minutes to say that Jill points to something really critically important, and that is when we include women, we are not excluding men. We are really trying to study women and men and see the difference, because if there's difference and we then homogenize the sample, pool the sample, mix people together, then we're not serving either women or men. We're creating a new norm that serves neither. And I also think it's important when we're directing our innovative efforts and our health resources and our research, it's important to identify areas where sex-based research may be particularly important and fruitful. And in that regard, I think it's often useful to look at where we already know on the basis of large data sets where there are differences in health between women and men. If we turn to U.S. data alone, we know that women are more likely to suffer from chronic diseases and disability, have acute and chronic pain, die following a heart attack, and specifically in terms of brain health, are more likely to develop depression, as well as Alzheimer's disease, as you've heard, and more likely to have rising rates of mortality from prescription opioids. Men, on the other hand, are more likely to have addiction to alcohol, develop Parkinson's disease, and have obstructive sleep apnea. So it's important to understand that these differences really have to be examined, because oftentimes in understanding the difference, there's a clue to an intervention. We need to understand these data, though, these epidemiologic patterns in all countries, not just certainly in the U.S. And we've made some inroads across the globe, but not as much as we need to. And we need to go into a variety of cultures and societies and groups in order to really understand this. One example of where we do have global data and this is a segue to my own work, is in the field of depression. Rates of depression in boys and girls is approximately the same. And then at the time of puberty, these rates begin to differ, and they remain different over the lifespan. In examining this particular pattern of divergent rates at puberty and the continuing divergence in rates, the World Health Organization has looked globally across various countries and societies and cultures, and they find the same exact pattern. The exact absolute rate may vary by culture or area or location being studied, but that difference is maintained across different societies and cultures and groups. And we see then at the time of great hormonal and psychosocial change, because that's how I would characterize puberty, changes both biologically and psychosocially that are enormous, we see the emergence of one of the greatest causes of disability for women worldwide, depression. Turning to my own work, I have studied depression in a variety of ways. Of special interest to me has been the relationship of stress and depression and whether this relationship is different for women and men. I have a few findings to highlight, and you have to tell me how much time I have to do that, because I want to give everybody else the opportunity to talk about their critically important work. But what we have found, without question, is that stress is a predictor of depression for both women and men, but it's a more potent predictor for women. And that really then provides us with very important information about how we might design interventions. So, for example, interventions to reduce depression risk for women in particular would focus more on the fact that women are more stress responsive and that interventions, particularly for women, could involve stress appraisal mechanisms, looking at how you assess the stress you're under. Are you ruminating about that? Are you using dichotomous thinking to think everything's black and white? Do you catastrophize? There's also ways to reduce reactivity to stress, so that although we can't reduce stress in our lives entirely, we can certainly reduce the way in which we react to stress.
Can I cut you off there?
Yes.
Okay, and I want to say, Jill, that is sort of a perfect segue into your new initiative, which I know is in partnership with the Harvard School of Public Health, and I think that's such an important aspect of the work that you're doing. So same question with a little bit of a spin to it.
Well, this is a great segue also from Dr. Mazur's talk, because major depression and heart disease are the number 1 and 2 primary causes of disability worldwide. And as we just heard, depression has almost twice the risk in women than in men, and heart disease is the number 1 killer of women in the United States from disease and in most middle-income countries. And major depression and heart disease co-occur really frequently, over 20% in the population, and that is worldwide, and women are twice the risk for that. And people who have heart disease who also have major depression have a 3- to 5-fold risk of death. So we are talking about not just morbidity that is more severe in women, but mortality as well. And finally, depression and heart disease are independent risk factors for Alzheimer's disease, and we know that there's a much higher frequency of Alzheimer's disease, as we've just heard, in women. And we also know it's not only because women live longer. So unfortunately, research and healthcare have really viewed these as they've largely ignored the sex differences in these diseases. And in medicine, we study things in silos, right? Very separate from each other. Now, what we have discovered is that these illnesses do not just occur simultaneously, but in fact they have shared causes. And those shared causes of these sex differences actually begin in early development, even fetal development. So that if we devise therapeutic strategies to both target these early risks earlier than Dr. Isaacson was saying, in fetal and early development, If we target our therapeutics, our policies, our public health policies, programming, advocacy work early, we can not only attenuate disability, but we believe eventually prevent some of these illnesses. We have no effective therapeutics for these comorbidities, or as the WHO calls it, multimorbidities. We don't have any effective therapeutics. We need to disrupt business as usual in medicine, in healthcare, and in public health policies. These illnesses will tank our economies if we do not come up with more new and novel ways to attack them.
Great. Thank you so much, Jill. So for Richard and Susan, what I want to talk about is your research is on prevention and on interventions that frankly should be easy, particularly in the developed world, but I think we really can get there. And so, you know, in our world, we have historically not thought about health. We think about illness. And so we really need to, if we're going to save the money we're talking about, really understand the risks in an aging society. How can your research, Richard and Suzanne, inform our ability to flip this on its head? In my organization, we are trying to think about brain health rather than brain disease as a way to change our orientation on the consumer side, healthcare provider side, payer side, and throughout the system. So, Richard, why don't you go first?
So you've heard some statistics that may have been scary. Here's the good news. Okay, yay. Here's the good news. 1 out of every 3 cases of Alzheimer's disease is probably preventable if that person does everything right. But in the other 2 out of 3 cases, we're not there yet. Maybe we can delay it 6 months, a year, 2 years, or 5 years. But if that person does everything right, and a new drug comes out in that 5-year time, well, then by lifestyle and grabbing the bull by the horns, knowing that brain health is actually something we can modify over time, then maybe that person can prevent their own Alzheimer's disease. So the take-home point is take control of your brain health. Get educated, get informed. Know your numbers, know your cholesterol, know your blood pressure. Talk to your doctor. Go to Google, although there's some weird stuff on Google, so be careful what you read on the internet. You can't believe everything you read on the internet, but there are some good resources out there. Okay, taking care of your medical conditions, exercise, specific types of brain-healthy exercise, Mediterranean-style diet, sleep, stress. I can go on and on. Moral of the story is take control of your brain health. We can do a lot. I'm going to start at age 25 and up. I'm going to leave the babies to some other people.
What we're really talking about is how to take control of our lives, and how we choose to live and how we're forced to live are 2 separate issues. But the biggest impact on these risk factors that I mentioned earlier, the cholesterol, blood pressure, the sugars, the weight, all of these things are so strongly impacted by diet and exercise. The foods that we choose to eat, the Mediterranean diet, as Dr. Isaacson just said, is probably the best way to go. Omega-3 fatty acids, fruits, nuts, vegetables. But what is it that we can afford to eat? What do we have access to? And I think that's part of this story. The life expectancy in Manhattan for the average person is 79 years old. You go a little north to the Bronx and the average life expectancy is 75 years old. It's based on not only access to care, health care, but it's also about access to food and really what's around. Exercise is one of the most effective ways to prevent dementia, to prevent heart disease, and around the globe, 1 in 3 women don't exercise enough, 1 in 4 men do not. There's been an increase in inactivity over the past decade, an increase in diabetes and obesity. And if we could get up and start moving, have you heard that sitting is the new smoking? If we can all get up and start moving just a little bit every single day, we can actually change the outcome of our health, our brains, and how we live our lives.
So I could go on all day, but I am very sensitive to the fact that at least 2 of our scientists have places to be, like seeing patients. And I really do mean it. I want to say that one of the reasons why we really wanted to be here today is because we want to see brain health on the agenda as we're addressing all these other important sustainability goals towards 2030. The statistics we cited for aging populations and the prevalence of dementia, combined with the incidence of women and the impact economically on women, it's just too much of an emergency to wait. I am certainly happy to talk about what my organization is doing in partnership with researchers, which is probably the most important thing we do, but also in clearing regulatory hurdles both in this country and around the world. And in many ways, most importantly, and Suzanne referenced this, Dr. Isaacson referenced this, in getting people to change their behaviors and also to change how they demand the healthcare system interact with them. So please join me in thanking all of our panelists, Dr. Steinbaum, Dr. Isaacson, Dr. Goldstein, Dr. Mazzoret. Thank you all for coming.